be talking about Rein in a Dream, operations and certification of a PATH International Premier Accredited Center during COVID-19. So I'll give Shannon a minute to get organized.
Okay. Can everyone see my screen?
Yes.
Okay. Okay, so hi, my name is Shannon Giguere. This summer, I was a therapeutic horsemanship intern at Rein in a Dream in Lancaster, Massachusetts. I waited to start my in-person internship in July, so I got to do mostly in-person work, which was great. I came into the MAPP program with a background in psychology and an interest in human-animal interactions. And I also have experience working with horses specifically. But as my knowledge base grew throughout the course of the program, it kind of reaffirmed for me that this is an area I'm really passionate about and I want to continue pursuing a career in the HAI field. So, go to the next slide. Oh, there we go. So, Rein in a Dream is a part of the Dr. Franklin Perkins School. So it was founded in 1896 in Newton, Massachusetts, and it was called the Hillbrow School. The name was changed in 1922 when child psychiatrist Franklin Haskett Perkins became the school's administrator. And in 1924, the campus was relocated to Lancaster, where it still is today. Changes undertaken in the 1980s shifted the focus of the organization to children and adolescents with emotional and mental health needs. So today, Perkins provides residential and day treatments, community-based services, an adult services program, an assisted living residence, a mental health group practice, and a therapeutic horsemanship program. So Rein in a Dream, in alignment with Perkins as a whole, is focused on mental health as opposed to other horsemanship programs that focus more and are better equipped to deal with physical disabilities. And I'll go over that a little bit more in a minute. But they serve Perkins residential and day students, as well as community members of all ages. And not a comprehensive list, but some examples of the types of students they work with. They might be diagnosed with anxiety or depression, autism spectrum disorder, ADHD, PTSD, or learning disabilities. So they offer traditional therapeutic riding lessons, unmounted horsemanship lessons, farm work and job skills programs, and small animal programs. So there's also goats, chickens, guinea pigs, and a pigeon on the farm. So that was fun. I chose this agency. I knew about them from previous volunteer experience, so luckily they remembered me, so I got to get my foot in the door. But I chose them because my interest in psychology partnered with my master's. It kind of offered me an opportunity to merge my interests in mental health, the equine industry, animal welfare, and human-animal interactions. So for those of you who might not know, there are a lot of different types of equine-assisted activities and therapies. So EAAT is kind of just an umbrella term for all activities where people and equines interact. Equine-assisted activities is a term used to describe any activity that involves a center's clients, instructors, and equines. So therapeutic riding and therapeutic horsemanship are both considered types of EAAs. And their purpose is to contribute positively to the cognitive, emotional, and social well-being of individuals with special needs. So that was mostly my focus for my externship. But also equine-assisted learning is considered an equine-assisted activity. It's defined as an experiential learning approach that promotes the development of life skills for educational, professional, and personal goals through equine-assisted activities. So this was a focus area for a lot of the residential students who might have been taking traditional therapeutic riding lessons, but they also participated in a job skills program. Hippotherapy, no, equine-assisted therapy is a treatment that incorporates equine activities or the equine environment. So rehabilitative goals are related to the patient's needs and the medical professional's standards of practice. Equine facilitated psychotherapy specifically is administered by a licensed mental health professional, and they commonly partner with equine professionals like a PATH certified instructor to address psychotherapy goals. Hippotherapy refers to the use of the movement of the horse as a treatment strategy by physical therapists, occupational therapists, and speech language pathologists to address functional limitations and disabilities. So the field of equine therapy started off this way. It's been around for a very long time. There was a big focus on the physical benefits of riding and the benefits as part of like a physical therapy program or someone with physical disabilities, kind of before people moved into the less tangible psychological benefits. But people are starting to come around to that as well now. So the Professional Association of Therapeutic Horsemanship is the agency responsible for certifying therapeutic riding instructors, as well as accrediting centers that offer equine-assisted activities and therapies. So it was founded in 1969. It was then called the North American Riding for the Handicapped Association. And this organization is considered a pioneer in the field. They're responsible for bringing the idea of therapeutic riding over to the United States from Europe. And today, there are more than 850 PATH member centers in the United States and across the world. And they range from small single instructor programs to large centers that employ multiple instructors, mental health professionals, physical therapists, and more. So it's not uncommon for these professionals to work together to create a comprehensive treatment plan for one client. PATH Premier Accreditation is a voluntary process that member centers can undertake. So Rein in a Dream is a PATH Premier Accredited center. That process involves site visits to ensure that the PATH standards are being met, and there's a standards manual that very thoroughly outlines industry standards in the area of center administration, facility safety, equine welfare, and activities. And those activities have to be facilitated by a PATH certified professional who's undergone a certification process, which is where I come in. So I'm in the process of applying to be a certified therapeutic riding instructor, or CTRI. So in preparation for submitting that application, hopefully in November, a large number of my hours have been taken up by providing lesson support. So assisting one of the 4 instructors I worked with. Rein in a Dream is a larger program, so I was lucky, even with the current circumstances, to be able to see multiple instructors in their specific teaching styles. So lesson support could involve leading, which in that case you're in charge of managing the horse's behavior and keeping things safe on that end, or sidewalking. Because of COVID, we had mostly independent riders, so physical, like over the thigh or holding the ankle, wasn't typically done this summer. So I was more of a spotter in that case. So yeah, we tried to limit physical contact, but it was hard. But another protocol that they had, the community students, there were temporary stalls set up in the riding arena, and we designated that area to the community students so we could reduce foot traffic with the res students who were still coming in and out of the barn. So one of my responsibilities was to get the horses down there and get them ready and take care of them afterwards, where they were supposed to be. And also the tack was sanitized between every lesson, and the brushes and everything. And when the students showed up, there's an example of one of the check-in stations. They washed their hands, signed in, they got asked a standard list of questions, and their temperature got taken and recorded. So we took every precaution possible, and luckily people were very cooperative with all of that. So another thing that I did was horse conditioning. So that could have been riding or lunging or groundwork. Conditioning programs are important for therapy horses. It helps to keep them in shape so they can better perform the lessons. And it's a good reminder of the cues they should be listening to. And you can also troubleshoot problem behaviors. So I have a picture of our friend Ruby there with me, and this is a horse that I worked with a lot. She's one of the newer horses in the program, and she came before everything shut down and all the horses got a break from work, and then things started back up again. And because she was new, she was still learning how to listen to a leader, a sidewalker, and a rider all at the same time. A lot of times, a therapeutic riding lesson is different than whatever career the horse had before, so it takes an adjustment period to get them used to everything. So she was struggling a little bit, but she's doing well. Rein In a Dream is also due for re-accreditation through PATH, so I'm assisting with that process, updating all of their documents in their handbook to meet the updated standards manual. Part of the CTRI application is a standards course and exam, so I've become very well versed in all of PATH's policies and everything like that. So that was something I did want to mention my paper, even though it's still a work in progress. But my working title right now is The Welfare of Therapy Horses and Implications on the Wellness of the Overall Equine Population. So my goal is to use my policy knowledge to look broadly at the equine industry and just understand how therapy horses fit in. So starting by examining the overall equine population in the United States, who these horses belong to, what their jobs are, look at overall equine welfare and factors that lead to neglect or abuse, and discuss what happens to horses that are unwanted. Unfortunately, euthanasia and slaughter are both things that are options and that do happen. And policy-wise, slaughter is very controversial. I got to do some research on that in the program, and it does tie into kind of what I did this summer a little bit. So an option for some older horses is donation or adoption into therapeutic riding programs, which is obviously looked at more favorably by the public, but there's not enough room for all of the unwanted horses to be adopted, and not all horses are suited to therapy programs. So kind of forcing them into that situation could lead to negative welfare outcomes. And I want to talk about the welfare outcomes of therapy horses and how to improve therapy horse welfare. Fortunately, from what I've seen, the programs that I've volunteered at, welfare is a big priority at these programs. All of the horses I got to interact with were very well taken care of. A happy horse means they're going to perform better in lessons, and it's going to be safer for everyone involved and lead to better outcomes for the student. So it's definitely not something that falls through the cracks. And I was happy to see that. So for lessons learned, that is Oliver up top, and that's Geronimo down the bottom, in case anyone was wondering. But lessons, firstly, it's not easy to become a therapeutic riding instructor. I think that's a good thing. I think it's a really thorough process, and I think it's that way for a reason. But I also think that because people might not be aware of the process and not really understand what instructors do, they might kind of underestimate the amount of knowledge that they bring to the table. I'm a little biased, but I think that the specific expertise of like equine human interactions that's kind of specific to our field is really valuable. And I think that it can be something that's positive for the horse and for the student and for the people that work there. That being said, therapeutic horsemanship isn't some like magical cure-all that alleviates everyone's struggles. I'm sure most people here have seen an article saying that horses cures PTSD, or like veterans, it's like magical. And those articles, you know, as we learned, the media can take study results and skew them. When it, you know, really it should be saying there are promising results when equine assisted activities are incorporated into a patient's treatment plan. That's not to say that it's not beneficial, but yeah. people have bad days and ideas that you have don't work. Things don't go as planned and accidents happen in the case of both the student and the instructor. So I think imperfection is a part of it, but I also think that that provides a lot of teaching opportunities. Things that go wrong can be a learning moment instead of something thought about negatively. So, but also these programs, it's not a place where every horse is going to thrive. I think it's a great option for older horses, and their owners might be looking to rehome them, give them a second career or a semi-retirement home. And from what I've seen, that's where most therapy horses come from. It's usually their second career. But for a horse that, didn't get a lot of handling in their first career, or a horse that's hot or spooky or is just doesn't have the right personality, trying to force them into that role is not going to be beneficial for them. So it's not for every horse. But Perkins tries to teach equine body language as part of the curriculum and really stress that we won't do something if it makes the horse upset. So it's okay if, the horse has a personality and has things that they like and dislike, because that also is a teaching moment. But some horses are just going to be upset by everything that's asked of them in a therapeutic program, so it's just not an option for them. But lastly, I already mentioned this, but people have been very grateful that the program decided to reopen. They've been really compliant with all the procedures, and everyone's been wearing their mask. Even the little kids in like the 90-degree heat, which has been a challenge, but they've toughed it out. I think especially now, this is something that students look forward to, being able to get outside and interact with horses. It's something that, people aren't getting it outside as much. So I think they're extra grateful. And I think the benefits of the program are just as apparent now as they were before. So I just wanted to say a special thank you to my mentor, Shauna, and my on-site mentor, Sherry, all of the instructors and staff at Rein in a Dream, and all of the MAPP program faculty. You guys are all awesome, and I've learned a lot. And yeah.
Okay, thank you, Shannon. Are there any questions?
I have a question.
Martha?
Yes. So Shannon, I thought that was fascinating, and I'm very interested in the topic. Can I ask you whether, and I apologize if I missed it, do the students have to, or the parents have to sign any waivers or a release of liability or things like that? Because what you were talking about at the end, some horses seem to be okay, but then they aren't, and there's an accident. I loved the topic, and I'm actually going to have to contact you. But is there any? Do you have people signing releases for liability?
Yeah. So at every riding school, it's I'm pretty sure it's required, but at every horseback riding facility, you sign a release before you ride.
Yes.
I don't know the exact law in Massachusetts, but instructors aren't liable for, the inherent danger of horseback riding. So everyone signs a release.
That's exactly what I was thinking of, was whether or not, if something happened to one of the kids, whether you would have any issues with, whether it would come back to you. And if
yeah. Negligence is an exception to the rule, but in general, yeah.
Thank you. Great job.
Okay, well, thank you very much, Shannon. I hope that you can continue in this. Okay,